Your health matters and your voice deserves to be heard. Introducing the show that puts you at the center of the conversation. From common illnesses to complex conditions to the questions you've always wanted answered. Top medical experts.
The cost of maintaining that bed on a daily basis 24/7, because an ICU is a 24/7 unit. One single bed can cost between 2 million and 4 million per day.
Real questions from the viewers, practical answers you can trust. Now, join us every Wednesday at 10 a.m. as we talk openly about issues that affect you and your family. Health Q&A talk show, your health, your say. A very good morning to you. Thank you for joining us still yet on UBC TV. Thank you. Sochi Raba was here shortly, and they were talking about Men Gather conference that will be happening soon. My name is Sophia Matovu, and it's the Health Q&A talk show where we are going to bring issues that affect you, and you surely have to participate because it's your say. Now, today we shine the spotlight on a condition affecting millions of people. And when I say millions, I do mean it, it's millions of people. Often without warning and without any symptoms, hypertension, and many of us commonly call it high blood pressure, but it's hypertension. It is called the silent killer for a reason, because in a way it quietly damages the heart, the brain, and the kidneys when left unchecked. And I repeat, when left unchecked. But here is a good, there is good news about hypertension. It can be prevented, it can be detected, and it can be effectively controlled with the right knowledge and treatment options. I normally tell you I'm not the expert when it comes to the matters. With me in studio is Dr. James Kaima, who is a senior consultant, adult cardiology at Uganda Heart Institute. He's agreed to grace us this morning because we thought we'd be doing blood clots, but based on your concerns from last week's show, we saw that there were a lot of concerns around that area. So the expert is with me here in studio. Good morning, Dr. Kaima.
Good morning, Sophie.
How are you?
Fine. Thanks for having us.
Okay.
And thanks for having Uganda Heart Institute at Uganda Broadcasting Corporation.
Thank you. Now, Dr. Kaima, I'd like you, let's start with first the usual simple, breakdown for the question. When we talk about hypertension or high blood pressure, what exactly is it?
So, high blood pressure, to the person out there, they're just numbers. Normal blood pressure, a number of 120/80, that's what people know, and that when these numbers exceed 140/90, then we say you have high blood pressure. But how are those numbers generated? So I liken it to the water system in Kampala. So you have the biggest pump of water at Gaba, and it pumps water through a network of pipes. So and that's how we are created actually. You have the central system, which is a heart, which is a pump. It's literally a pump. And that, it pumps blood that has oxygen to the rest of the body through a network of blood vessels, which are the pipes. And once the body has extracted oxygen from the blood, then through a network of other pipes, blood vessels, that blood goes back to the heart, and it's sent to the lungs to pick up oxygen, and so the cycle continues. So to be able to pump that blood, the heart generates a pressure. Just like, Gaba generates a pressure to pump water throughout the rest of Greater Kampala. And that's a pressure then that we measure. The pressure that is up on that number is a pressure that is measured when the heart contracts to pump blood. And the lower pressure is a pressure that's generated when the heart relaxes. So that's how the numbers are generated. And normally that pressure is measured in units we call millimeters of mercury. There are different ways of measuring different units. Some are pascals, some are bars. When you go to the what do you call it? To the petrol station to fill your tire. I think that's in pascals. They say it's 33 to 40 kilopascals, but here we measure it in millimeters of mercury. And so the number is 120 over 80 millimeters of mercury. When the heart pumps, its contracts, generates a number of 120 millimeters of mercury. When it relaxes, generates a number of 80 millimeters of mercury. Now, how does high blood pressure come about? High blood pressure is actually a disease of blood vessels. It's not a disease of the heart. And it's just that the heart only responds to a challenge that is in the blood vessels. And what usually happens is the blood vessels narrow throughout the body. They become narrow. And then the heart has to generate a pressure to overcome that narrowing. And so the pressure has to be higher. You just, again, imagine that you have an obstruction in the network, in the network area. Then the engineers in GABA have to generate a higher pressure to overcome that obstruction. Now, this obstruction actually happens in narrowing of the blood vessels. The blood vessels actually get narrow, and so the heart generates higher pressure to overcome that narrowing. But what the pressure does eventually is that it corrodes the lining of the vessels because it's high. And that's where most problems happen. That high blood pressure corrodes the lining of the vessels. It weakens those vessels in some instances. And that's where then you get all the complications that we see people come with to the hospitals. And that, in brief, is how pressure is generated and how high blood pressure becomes a problem. The other extreme is low blood pressure, which is also not good. Imagine that the pump is weak.
Oh, yes.
You won't get water in your taps. So it's the same thing here. Remember that the blood carries oxygen. So if the pump is weak, then the oxygen that's required for the normal functioning of the heart, of the body, won't get to the cells, to the areas where it's needed. And those cells, actually, some of them die, others just simply malfunction. And then what you have is a problem, especially happening in the major organs of the body. Okay, so high blood pressure is bad, especially if it's sustained. And low blood pressure is bad if it's sustained. Now, usually when you have an event that excites you, or you've been running up a staircase, your blood pressure actually goes up. And it's a normal response to excitement, normal response to exercise. That's not high blood pressure. Or it's high blood pressure, but it's not hypertension. Hypertension, we call it that if the blood pressure is actually sustained in that high manner. So you have a sustained high blood pressure. That's what we call hypertension. And it's that being in a sustained high manner that then causes all the complications that we talk about.
Okay. Now, I did mention, and it's a fact, that millions of people, because they'll tell you that now become permanently hypertensive, maybe because of, how should I say, work-induced pressure, many different factors, or risk factors that would lead to that. How big is the problem at the Uganda Heart Institute? How many of those cases, say from maybe yearly as a head of other cardiology, do you keep seeing, or would you say that now the peak is at this?
Okay, maybe before we go to the Heart Institute, let's look at the global situation, because what you see at the Heart Institute or even in the hospitals, other hospitals, is only a tip of the iceberg, especially because high blood pressure is a silent disease. So by the time, you know, someone comes with a complication, that's one out of many people who are suffering this silent ailment. For example, the world has about 6 billion, almost 7 billion people. And we know that about 30% of those actually have high blood pressure, about 1.5 billion. When you bring it closer to home, if you count 4 people, 1 of them has high blood pressure. So which means that about 26% by the recent count in the STEP survey, which was done last year, 26% of Ugandans had high blood pressure. Beyond that is the biggest problem of people not knowing that they have high blood pressure. Because a lot of studies that have been done, even as recent as last year, show that almost, you know, between 70 and 80% of people who have high blood pressure, they've never figured that they have high blood pressure. And that's why then the burden of complications is high, because you know, people do not measure their blood pressures. And yet we visit health centers, and at every triage room or every emergency room there is a blood pressure machine. So you know, every time that we visit a hospital, you should get your blood pressure measured, because then you could become a statistic, and you don't want to become a statistic. But also, it could be that you go to the hospital just to have your blood pressure measured, rather than making it an opportunistic event. You could actually go and say, you know, today I'm going to have my blood pressure measured. At least every year, have a blood pressure measured. But also, if you feel bad, you know, if you get any sort of symptom that is related to blood pressure, and I think we shall talk about the symptoms, then you need to get your blood pressure measured. So I think that's the most important message, that, you know, you count 4 people and 1 of them has high blood pressure. So if we had another 2 people, 1 of us would have high blood pressure. And so it's important that, you know, everyone measures. Again, the biggest challenge is that it's a silent disease, and that you know, you get complications without ever knowing that you had the problem. And that's why we emphasize, you know, health checks, wellness checks that involve not just, you know, measuring of blood pressure, but also other what we call cardiovascular disease risk factors, because these ones actually combine with high blood pressure to cause problems. Things like diabetes, things like you know, cholesterol, high cholesterol in the body, things like, you know, just being obese, you know, being overweight or obese, which is also a growing problem. Those combine with high blood pressure to worsen the situation. Yeah, they are synergistic. I don't know if that's the word. They work together to worsen the complications, and because the complications are all on these blood vessels, and the corrosion, as we called it. So you have the hypertension corroding the blood vessel. You have fat, you know, building up in the area where the corrosion has happened, and you have, you know, that fat causing, you know, strokes, causing heart attacks, you know, causing blindness, yeah, things like that.
Wow. You talked about it. It is something that people never really pay attention to in terms of cholesterol, because I think of the cost that is involved in doing that particular test. Now, at what specific age? Because there are certain times, now you're even seeing high blood pressure among the young people.
Yes.
Yeah? You would possibly tell us the symptoms and then delve further into, like, is there any specific age that somebody should start taking those checks? Because now, given that it's also common amongst the young generation.
Yeah, it is common, mainly because the risk factors for high blood pressure are increasing, and to such an extent that we now at the Heart Institute are mooting a clinic for young people with high blood pressure. That's how common it's getting. And the problem around hypertension in the young is that, first of all, it's come too early. And a lot of times when we start people on blood pressure medicines or any blood pressure interventions, to sustainably reduce blood pressure, they have to be on these interventions for a while. Now, young people and attention to that is problematic. So you ask at what age? It should be, you know, every time a person goes to the hospital, they have their blood pressure, whatever age it is. But certainly beginning the teenagers, people should have their blood pressures checked. And certainly we know that high blood pressure occurrence increases with aging, so that by the time people are above 50, almost 50% of them have high blood pressure. 50% of that means 1 in 2 people have high blood pressure. So the older one gets, the more likelihood they're going to have high blood pressure, and the more care they have to take to measure their blood pressure, but also control it. In terms of symptoms, again, as silent a disease as it gets, a lot of patients, by the time they get symptoms, complications have happened, and it's the complications that actually give you the symptoms. People get headaches, and these headaches are characteristic. That, you know, someone wakes up and he says, I have a headache at the back of my head. That's where the problem is. Every morning, I have a headache. You should probably go and have your blood pressure get checked. Then you have visual disturbances. Visual disturbances can be a reason, and dizziness can be a reason for you to get a blood pressure checked. Could be the, you know, complication, a symptom of high blood pressure. Then, you know, the big organ that's affected, of course, is the heart, because as it pumps, as the pressure goes up, it gets tired. You know, you keep pumping against that pressure, and what happens is that you start getting tired, especially as you climb a flight of stairs. You get, you know, awareness of your heartbeat, what we call palpitations. You can get chest pain as you walk, because we know that high blood pressure can cause problems to the blood vessels of the heart. They can get narrow and they can get blocked. So, and that manifests as chest pain, especially as you walk. And then, you know, people can get trouble with urination because high blood pressure can affect the kidneys. Some of them, their urine volume and frequency becomes low. Others have dark urine as part of complications. And then the big one is that high blood pressure does cause erectile dysfunction. And a lot of people come to us because that's what is their major concern, and you do their blood pressure and it's high. So it's like, you know, the symptoms affect 4 major organs. So we say it's like a 4-barreled gun, all right? One that's affecting the brain, so dizziness, you know, headache, weakness. One that affects the eyes, manifests as blood vision, double vision. One that affects the heart, and then one affects the one that affects the erectile function of especially men. So those are the sort of symptoms that one can have. And in the extreme, people can come with a stroke, unfortunately. And for some people, that's the first time that they present to the hospital because they are weak and that they've woken up and they can't move their limbs. You know, it can be as bad as that.
Now, what are some of the causes? Do we have any specific now, because you as a specialist in that area can be able to guide the layman that these are what cause and lead to that trigger? Because yes, we have seen the symptoms, but certain times, certain people I know work-induced pressure can lead to that, where, you know, people are working in that kind of environment where everything is about meeting deadlines, then the tension can lead to somebody getting into that kind of state.
Okay. Strictly speaking, when you talk about a cause, it means you can take it away.
Exactly.
And that then the problem goes away. So strictly speaking, only 10%, 5-10% of high blood pressure has a cause, which means that you have, say, a hormonal problem that leads to increase in blood pressure, or you have a narrowing of your heart artery that can go away. Maybe one part of your artery, that the one that takes blood to the rest of the body, the aorta is narrow, and then the heart is trying to pump against it, and when they take it away, when it's operated on, the blood pressure goes away. So you can only count a few of those cases where the cause can be identified and removed. For most cases, we talk about risk factors. And risk factors act together to cause high blood pressure. And the risk factors that we talk about are sedentary lifestyle, an increase in salt intake. We talk about risk factor of, familial risk factor. That means that if your mother had high blood pressure, then you're at an increased risk of having high blood pressure. We talk about those are the risk factors that we talked about. Those are the things that come with high blood pressure. So diabetes, for example. If you have diabetes, you're more likely to get high blood pressure. And vice versa. If you have high blood pressure, you're more likely to get diabetes. So one of them can be a risk factor for the other. Not really a cause, but a risk factor. If you have high cholesterol, then you're likely to get high blood pressure. If you're obese, you're likely to get high blood pressure. In fact, even if people say that, obesity is not a cause, I think in my experience it actually is a cause, because if you get a patient that has obesity and they deal with it, actually can cure their high blood pressure. So for me, it's actually a cause. Although, when you read literature, a lot of people say this is only a risk factor. Anyway, because we know the risk factors, it means that when we deal with them, we can either delay the onset of high blood pressure or postpone it for a while. And that's what makes high blood pressure a manageable disease. That for the majority, we don't know the cause, but we know the risk factors. And if you manage the risk factors, for a few people, you could get away with it. Other people who don't get, don't get control of their blood pressures, then you have to start on medication that would reduce the blood pressure. Yeah.
Now, because you talked about treatment options, of course, being available, and possibly also managing it, and so what options, because you find situations of some people and someone will get very comfortable saying, let's say so-and-so uses this particular drug, so since I've been diagnosed with the same condition, I can also use the same drug.
Yeah, so first of all, when you talk about treatment or management of hypertension, you're talking about controlling those numbers. That's why there is a drive for people to know their numbers, know what your blood pressure number is. But the most important aspect is, because increasingly we recognize hypertension as a lifestyle disease, the first line of treatment is addressing lifestyle issues. We talked about a sedentary lifestyle, or physical inactivity as being a top risk factor for high blood pressure. So just getting people to move regularly actually reduces their blood pressure. Getting people to reduce the salt in the food, in their food, helps reduce the blood pressure. Getting people to control other risk factors like diabetes, obesity, and dyslipidemia helps people reduce their blood pressure. And that's where we start. Before then, we talk about medicines. And the medicines, we usually use them either if you come when your blood pressure is so high, or if these lifestyle issues, we fail to manage them, because it's also not easy to manage them. We usually dispense out these lifestyle, advice, and you think that someone is going to do it. It's not easy, because life is a hassle. People have to make money. People have to take children to school. So building in lifestyle changes in their life usually is a challenge. So we start you on treatment, and we have a lot of medication for high blood pressure. Lots of groups of medication, and much as when you come to us, you can start one types of medication, not one size fits all.
True.
Which means that if you have your blood pressure medicine, I probably shouldn't be sharing it, because I am unique. Every patient is unique, and so you were better served going to the hospital. The hospital, first of all, diagnosing that you have high blood pressure, because sometimes I catch you on the street and take your blood pressure and it's high, but you're in fact not hypertensive. It's that thing that we talked about, that you have an adrenaline rush because you're chasing money, and then your blood pressure goes up, or you've been climbing a flight of stairs. So the hospital makes sure that you're actually hypertensive, meaning you have a sustained rise in blood pressure, meaning that they don't do one blood pressure measurement, they actually do multiple. And some people actually, we do give them a blood pressure machine to go home with and measure the blood pressure in the morning or in the afternoon and in the evening, and write down and bring us a record. And for other people, for advanced clinics, we actually give them what we call ambulatory blood pressure monitors. It's a machine that you go with home, which constantly measures your blood pressure. And within 24 hours, we have a diagnosis of high blood pressure, because then it shows us that your blood pressure was sustainably high, sustained rise over the last 24 hours. So that diagnosis has to be made very clearly, because you don't want to start on medication and the medication makes you sick. And then what then happens is, after that's done, we do tests, investigations, to look at other risk factors, the ones that could either cause high blood pressure or the ones that could worsen the risk of high blood pressure. And those ones, depending on what risks you have, your medication may be different. And then thirdly, then the doctor can choose what medication is appropriate for you, depending on all this information that he puts together. So it's not a one-size-fits-all. You really need to go to work with the healthcare worker to decide which medication. And then there is, again, the issue of side effects to the medication, because these are chemicals, and every chemical you take may come with potential side effects. And not everyone gets side effects. Maybe about between 5 and 10% of patients who start on high blood pressure medicines get side effects. But those side effects are unique to the person, which means that medication that worked for me may not work for you. Again, emphasizing the importance of working closely with the healthcare worker to decide what's the best fit for the person coming with high blood pressure.
Okay. Now, I'm glad you've really clearly explained it. For the person who's just joined into the show, this is the time for you to be able to send in your questions. That's why we have the expert in studio to respond to them. Now, Dr. Kaima, there is a famous one that most people sometimes preferably do. they would know, and possibly they've been diagnosed and it's been proved beyond reasonable doubt that actually they have high blood pressure, and they are started on a treatment plan. But some of them, I don't know whether it's because of the resources, there is a belief and a mentality that the herbals do work. Ninagundi afumba kadomola here, and for me, when my mother used it, it did work out for them. Kindly speak to that.
Yeah, so medicines are actually formulated from different things. Some of them are the herbal medicines. So some of them are herbs, actually. What the formulation helps us do is to know how much of that medication you're going to take. For example, when you go to the clinic, the doctor will tell you take 5 milligrams of this formulation, which is difficult to do with the cardomola, because the cardomola, we don't know how much, what is in one cardomola. Is it 5 milligrams or 10 milligrams of a certain formulation? So I think there is no, and you know, I think that some of these herbal medications do work, but what is it that you're going to take to bring down the blood pressure by this much? And that's where these formulations that we use assist us, because they are measurable, right? So you come to me and I say, no, now this milligrammage didn't actually improve your blood pressure control. Can you increase that to maybe 10? Now, with the cardomola, what are you going to tell that person? Or with the leaf, are you going to say this type of leaf, increase it to 2 leaves? You understand.
True.
And then there's also the misconception that the herbs do not have side effects. They actually do have side effects. In fact, when you go to the liver ward in Mulago, a lot of the problems that patients come with are herbs having burnt their livers. And so they are not totally harmless as it's marketed. And although they may do the job, you want to know how much of that does the job. Now, we do have the National Chemotherapeutics Laboratory that is trying to get these herbs and formulate them so that you know how much works for what drop of blood pressure. But until that time, when we have a clear, milligrammage, it's difficult to recommend some of these herbs. Yes.
Okay.
Yeah.
Now we have, I am Henry from Tororo, a victim of hypertension in general health condition. I am allergic to sulfur, specific septrin. How can I prevent, control, and detect danger signs of high blood pressure?
So we've spoken about the danger signs, actually. We've talked about the 4-barreled nature of hypertension in causing the complications, but it's complications that usually give you the signs. And we talked about headache, we've talked about dizziness, we've talked about, stroke symptoms, we've talked about, breathlessness, palpitations, chest pain. We've talked about erectile dysfunction and kidney, symptoms of kidney problems. And then as regards the control, it's a good thing that he knows that he's hypertensive. That's the first step to take care of your health, knowing what you are. Because like I said, in the recent study, STEP survey, almost 70% of people who are hypertensive didn't know they're hypertensive. Now that's a challenge. But it's good that he does know his status, and the next thing then is to work with a healthcare worker to improve his blood pressure control.
Then this is, good morning, moderator. This is a nice program for hypertension. Could this medication affect my kidneys, electrolytes, or heart rate?
Oh yes, so those are the sort of things that you have to work with the doctors for. So for example, there are medications that will bring down the heart rate, but there are those patients who actually benefit from the heart rate coming down, right? The medications actually, we talked about high blood pressure being the far most risk factor for kidney disease. So it's very likely that when you start on blood pressure medications, the kidneys are going to actually be protected. And there are actually types of medications that protect the kidney, such that when someone comes with high blood pressure and we detect kidney function from high blood pressure, we put you on those types of medicines. For patients who have advanced kidney disease, there are some blood pressure medicines that won't work for them. And so, we choose these medications carefully. It speaks to the importance of working with a doctor to decide what's the best medicines for you, and then to desist from, sharing these medications out. Because if I give someone a drug and it's because they have kidney dysfunction, kidney problems, you don't know if you have kidney dysfunction or at what level your kidney dysfunction is, and whether this drug will be deleterious to you or it will be beneficial to you.
Yeah, true. Yeah. This same person is asking, what happens if I miss a dose?
What happens, you take the dose when you next remember. Of course, if you miss multiple doses, then it's likely that your blood pressure is going to go up precipitously and cause a problem. Because that happens a lot, I likened it to, holding a dangerous animal by a rope, and then suddenly you let it go. Yeah, what happens? To the people around, the animal will attack them. So it's the same thing. It's the same example that I use with hypertension. So you've been controlling your blood pressure tightly, and then you suddenly stop the medication, and what happens is that the blood pressure shoots up precipitously, and that's likely to cause problems. Yes.
Then the same person is asking, do I have to take medication through my life even when the numbers reduce within the normal ranges?
You need to keep taking your blood pressure even when your numbers are normal, because the blood pressure medicines is actually the reason why your numbers are normal. There is a chance, however, to go off these blood pressure medicines, especially if you address the lifestyle issues that we discussed earlier. And in practice, I know about 20 to 30% of patients can actually go off blood pressure medicines, especially if they come in with those risk factors. It's more difficult if a patient didn't come in with those risk factors. There are those patients who come in and he's lean, he has been eating well, but they're hypertensive. Those ones are difficult to even promise that they'll ever get off medicines. So I think in brief, it's possible to get off the medicines, but should be done very carefully with the advice of a healthcare worker. For most people, they're going to need medications for the rest of their lives. And if you forget to take your medication, as soon as you remember, you take your medicines.
Because there are certain times, maybe I'd like to speak, there are certain times where you'll find that there is, what should I call it? Do you give people a medicine holiday? Like some day, you maybe, because some of them have quite a package of drugs to take, medications to take. So they get fatigued, and just like the bit of like popping the pills maybe for high blood pressure on a regular, some of them will be stubborn and get to a point and feel like, no, I need like a holiday off and get off the medicine for some days, then get back to it. I would like you to speak to that.
So that's the biggest challenge with chronic diseases, and not just hypertension, but all chronic diseases. Talk about HIV, talk about diabetes. It's a big challenge, and it's even worse if the problem is silent, like high blood pressure, because someone says, what's the justification of me taking blood pressure medicine for the rest of my life? Wait, I feel good, right? So, but the challenge with that is that then your blood pressure is going to be high and you're going to get problems. Even if we manage to get you off the medication, it doesn't mean that you're not hypertensive. And we ask everyone that we working to take off medication to continue taking their blood pressure readings, because then if there is a problem, we can easily pick it up and maybe reinstate the medicines, or even address whatever lifestyle issues that has recurred. So in brief, yes, we can take you off blood pressure medicines. We can give you a drug holiday, but it has to be well managed. and not everyone, in fact, the majority, would never go for medications. I've told you the numbers. I've told you between 20 and 30% if they adhere to lifestyle issues. But again, at some point, their blood pressure can start creeping up, and we reinstate them on medication. So it's because it's a chronic disease, it has to be chronically monitored, and we have to be judicious about how we go for medicines.
Okay, if you're to give them a drug holiday, how long and what would help you? Because if a patient talks to you in that nature, I feel I am tired, I feel I'm fatigued of taking this medicine all through, and you really like feel it's worth them having a drug holiday, for how long and what? Is it off all, let's assume, if you're taking a number of how many, is it off specific ones?
Exactly. So first of all, I wouldn't call it a drug holiday. But I would say, you know, you're working with the doctor to reduce the pill burden.
Okay.
So increasingly we have what we call single pill combinations, where, you know, rather than take 3 pills, you're taking 1 pill that has 3 types of medicines.
Okay.
Kauke kamu bikolo bisatu, right? And that has improved, you know, adherence to medications in a great way. So someone who was taking, you know, 3 or 4 pills twice a day is taking 1 pill once a day with food. So that has helped a great deal. Apart from thinking about, you know, single pill combinations, we also think about which medication should we take you off. Because when you are at risk of something, again, we have to be judicious around the way we remove the medicines. Then finally, if we manage to take you off medications, it's not a drug holiday. It is that we've managed to control your blood pressure using the non-pharmacological means, and we are trying to see if we can take you off the medication and you continue living that lifestyle to ensure that your blood pressure is low. So there are no drug holidays in blood pressure measurements. It is, we are taking it, you have to make a conscious decision to take a patient off medication if their blood pressure is controlled, and highly dependent on these patients adhering to lifestyle measures to improve their blood pressure control.
Now, in terms of treatment options or the treatment, is it free when somebody comes to Uganda Heart Institute for managing their high blood pressure?
Yeah. No, it's not completely free. I mean, there, for example, at the Uganda Heart Institute, there are some payments that have to be done to be able to sustain the service. They are very highly subsidized, though. It's not as though you're going to a private practice. Yeah. And even the medication, some of them are free, others you have to buy them. Even those are very highly subsidized. So government works to fund the Heart Institute to reduce as much as possible the prices of these drugs, so that care can be accessible to most individuals.
Okay.
But you know, when you go to other health centers, again, you'd find some medication that is free and some that you have to buy. So it's still challenging, but also because the government has a lot of priorities. Infectious diseases is one priority. HIV, for example. There are lots of people on HIV medication, and I think government is trying to make those free as well. So I think it's sort of balancing. Rather than give something for free, why don't we, you know, subsidize it highly, so that at least, you know, the cake goes a long way in serving many people.
Okay. Yeah. Then how does high blood pressure, you know, lead to stroke, possibly heart attack, or even kidney disease?
You explained that.
You explained that, you did.
But just briefly, the way it does it is that it corrodes the inside of the blood vessels that go to those organs.
And even for the kidney?
Even for the kidneys, yes.
Because you've had people say that they have developed chronic kidney syndrome because of the high blood pressure.
Chronic kidney disease, yeah. So again, it corrodes the blood vessels, inside of the blood vessels. And then it's that then causes, for example, in the kidney, the small blood vessels start to leak protein they start to leak blood, and then it's that leaking of protein that worsens the kidney dysfunction. Now, the relationship between high blood pressure and the kidney is interesting. If someone has primary kidney disease, then that kidney disease is likely to cause high blood pressure. And if someone has high blood pressure, it's likely to cause kidney disease. So someone, for a lot of people, we don't know what came first. Is it the chicken or the egg? You know that story. Yeah. So, but we know that if someone, a young person walks in with kidney disease, it's likely that their blood pressure is going to be high. And it's one of those things that I told you about. Some of that is actually curable. That if you find that the kidney disease is causing high blood pressure, and you can cure the kidney disease, actually the blood pressure goes away. So those are sort of the things that you look at. So your assessment for high blood pressure is never complete until your doctor actually does a kidney assessment, because we want to know whether the kidney is the cause of high blood pressure or the reverse, has high blood pressure actually caused kidney problems. So they're likely to ask you for a urine analysis to look for, protein in urine or blood in urine, or they are likely to ask you for a kidney function test, which is a test that is done in blood to see if the waste products that are supposed to be excreted by the kidney are actually accumulating in your body, which tells us that you have some sort of kidney problems.
Okay, what gaps do you think still exist in terms of awareness for the layman, and maybe how can the community come and fully participate?
It's not just for the layman, but for everyone. And I'm glad that UBC gives us this opportunity to actually speak to high blood pressure and other heart diseases, so that the public there can create more awareness. We do have screening services. Usually they come in waves that should be taken advantage of by the public. But also, for example, in May, in conjunction with the Uganda Heart Association, there will be a screening session at the gardens here at KCCA, somewhere around May. But most importantly, we need to take care of our health. We need to be responsible to ourselves, to teach ourselves, because managing any chronic illness, particularly hypertension, is as simple as catering to your needs. So when we talk about needs, we are talking about nutrition, we are talking about exercise, we are talking about educating ourselves around whatever disease, in this case high blood pressure. We are talking about drugs, if you have to take drugs, and we're talking about self-monitoring. So the self-monitoring is also important. That if you for high blood pressure, you don't even have to suspect; you just have to go and measure. Okay, but if you've measured and you've been found hypertensive, then it's good to keep a blood pressure monitor in your home, and you take a blood pressure morning and evening and register a blood pressure reading, so that when you go to your hospital, the doctor knows exactly what he's dealing with.
Okay.
Because the blood pressure measurement that's done in the hospital does not represent what blood pressure measurement you have at your home, and the other one is the most important.
Okay.
Yeah.
Now this is Henry still from Tororo, who says, government is not supporting us, and what can we really do to support ourselves to live long with the condition of high blood pressure? That's what he feels.
Yes, I mean the sentiments are well recognized, but I think government is doing everything possible to keep a healthy population. And I think he's from where?
He's from Tororo.
From Tororo. And I think that the health center in Tororo, they do have some blood pressure medicines. Recently, we've been revising the essential drugs list. Recently, we had a revision of that, and the Heart Institute contributed to that list. And we know that the best blood pressure medicines, the ones that have been informed by research, have found their way into that essentials drug list. Now, with the essentials drug list, we think that that medicine is prioritized by the national medical stores, and that will find its way to even the lowest health centers, if not at a free, at a highly subsidized price.
Mm-hmm. That's quite interesting, because when you talk about a scenario like that, because there's some of those medicine you don't even find in your ordinary pharmaceuticals when you go looking for them, but can only find them in that specific hospital.
Yes.
Right?
Yes.
Wow. So if somebody starts, at what stage, say, when you say that now, as me, this is the time when somebody should start on medication, what should the readings be like, and after that is consistent monitoring?
So we usually take a reading of greater than 140, the up one, what we call the systolic, and greater than 90, the lower one. But again, it has to be a sustained increase in that, in those readings. It's not like a one-off and then you start medicines, because it's going to make you sick. They do have side effects. So 140 over 90, then we start the intervention. Again, the intervention may be lifestyle. So you come to the clinic, they say, yo, your blood pressure is slightly high. Why don't you go and, start on some lifestyle measures, reduce the salt in your food, exercise, reduce your weight, and let's see you in 3 months and see what your blood pressure is. Or in the meantime, keep recording your blood pressure and come back to us in 3 months. If it's still high, then the doctor is going to start you on medication. However, there are levels of blood pressures that patients come with, and you have to start them on blood pressure medicines. If the blood pressure is greater than 150 systolic, greater than 90 diastolic, those patients, you have to start them on blood pressure pills and then monitor them. And then, they get back to you with with their home records. And it's important, the back and forth between the healthcare worker and the patient, to ensure that there's control of blood pressure.
Then are there scenarios, because of, how should I say, much as the person has been on for long use and maybe some organs have been affected as a result, that it will fail to lower back and get back to the normal readings or normal range?
Yeah, we have such a type of blood pressure that we call resistant. And what usually happens is that we use more medication to bring down this blood pressure. And when people have resistant high blood pressure, we also try to look for whether there is a cause of this blood pressure that can be treated. So yes, there's resistance sometimes, but gladly we have a lot of medicines, a lot of type of medicines, and each working at a specific point in the body to bring down the blood pressure. And it's, for some people, we found that this type of medication doesn't work, and this one works. So some people get frustrated. They say, look, I've been to this doctor, he's given you this medicine, but they've been to the doctor once, and he says it doesn't work, so you come to this doctor. So the idea is you work with your doctor to find the best medicines for you, the best intervention for you, depending on what your type is, what your other risk factors are, what we call comorbidities are. Yeah, so that's one of the challenges that we get. The doctor is dismissed as someone who doesn't know what they're doing.
Doesn't know what they're doing.
They haven't been given the chance to assist the patient.
Okay.
Yeah.
Good morning, UBC. I had low blood pressure last year in August, and I lost my sister. It was terrible. I had a lot of worries. It almost gave me a stroke, but I managed it. I'm Vicky, 34 years, in Tororo. Thank you for the show. Then, good morning, doctor. Please support the purchase of an HP monitor from Jumia. Okay, this is a person, this is Robert from Makere, who is asking for your support to purchase for you. Then, what are some of these best herbs that can cure or prevent high blood pressure? This is Joseph from Chambogo University. I don't know, doctor doesn't deal in the area of herbs, so I'll excuse him from that. Then this one is, okay, they're still flowing in. Okay, this is Alex from Gulu. Thank you for supporting our people. My father has been on antihypertensive treatment since 2002. He used many drugs, but his blood pressure rises higher, especially at night worsened when it's raining.
Okay, so there are many questions there, but what warrior is our Kalango, okay? You know. But you know, just to support him, home blood pressure monitoring is an important aspect in the control of blood pressure, right? So again, people come to the hospital and they have been hypertensive and haven't measured their blood pressure in the last 3 months. And they walk into the hospital, measure their blood pressure, and it's high, and we adjust their medication. But that's not the right thing to do. The right thing to do is you purchase a blood pressure machine from wherever. It could be Jumia, it could be a pharmacy, a neighborhood pharmacy, and take that home and measure your blood pressure and then report back. Then the last question was around...
The person was asking, okay, this was her asking. Oh, sorry. The person was asking about, this was Alex from Gulu, I think. The father has been on hypertensive treatment since 2002, has used many drugs, but his blood pressure rises higher at night, and it's especially worsened when it rains.
So that's what we talked about regarding different blood pressure types. There's such a type of blood pressure that goes up in the night, and that requires a different approach. So for most of our patients, we tell them to take their blood pressure medicines in the morning, but there are those patients, because we've been able to pick up a rise in blood pressure at night, we change the time that they take their blood pressure medicines. And we say you take your blood pressure medicines in the evening at 8 p.m. The importance of that is that blood pressure rises in the night. Normally, blood pressures actually drop in the night because you're sleeping and you're not doing a lot of activity. We call it dipping. The blood pressure dips in the night. But if it goes up, then we call that reverse dipping or non-dipping. And that has been associated with increased morning strokes. Yeah. So it's important that we catch that phenomena and that we advise that the appropriate actions are taken, like, you know, being able to take your medication in the night. Now that monitor I talked to you about earlier, the ambulatory blood pressure monitor, picks that up very well, and you can actually be able to appropriately manage that type of blood pressure. So maybe what his dad needs to do is just to change what time he takes their blood pressure medication. Again, I can't give that advice. He needs to go to the doctor and report that specific phenomena so that the doctor can decide how to help him.
Okay.
There's another one.
There's another one. The doctor has, good morning, doctor. His doctor said that the cause of high blood pressure is mainly clogged blood vessels. What can be done to clean them up?
So like we said, it's probably not the cause but the effect of high blood pressure. We said high blood pressure together with its comorbidities can actually clog up your arteries. And we said the cause of high blood pressure is actually the small blood vessels narrow, and the heart has to pump blood at an increased pressure. And when it does that over time, then it destroys the lining of the blood vessels, the inside lining of the blood vessels. And then, you know, if you have cholesterol, those can get clogged up and then cause problems. So the way you treat that is actually treating the blood pressure, and also recognizing other risk factors and treating those as well.
Okay. Then this one didn't mention who he was. He said, should I expect my libido to increase when my numbers remained within the range? Because the truth is I had lost libido and was taking Viagra. Do I expect some improvement, doctor?
So high blood pressure, one of the complications is erectile dysfunction. And we think that when you control your blood pressure, the erectile function actually does recover. There is a caveat though. Some of the blood pressure medicines, and not all of them, can, for a few individuals, cause erectile dysfunction. And there are those that we recognize and we appropriate them depending on what the patient tells us. So high blood pressure can cause erectile dysfunction. That can be permanent. The medication, some of it can cause erectile dysfunction. That's not permanent. And the beauty is that we have so many groups of drugs, and it's only like 1 or 2 that causes erectile dysfunction, and we can quickly pick it out and give you something else. And also, it's not like everyone who takes this medication actually gets erectile dysfunction. So you're better served actually being on the blood pressure medicines, because the effect from my blood pressure can actually turn out to be permanent. But the effects of the drug is transient and can easily be managed.
Then what about the fact that he's taken to Viagra as an option to ensure his libido is back to where he wants
first
it?
of all, Viagra, of course, is a miracle pill, as you can imagine. But it has to be taken with caution as well, especially if you have these hypertension and diabetes, because it can cause a drop in the blood pressure and then can cause death. You've heard about death
true.
being caused by Viagra, and so, sudden death being caused by Viagra. And the way it does that, it suddenly drops the blood pressure. And then you can either get a heart attack, you can get a stroke, you can die from that. So they have to be used with caution, but also probably after a thorough assessment of your cardiovascular disease by the cardiovascular system by the doctor.
Okay. Then good morning. I'm experiencing a condition where I feel pain at the heart, like something is holding it so tight with difficulty in turning. Also very slight cough. During cold seasons, I feel the cold pierce through the chest. What could this be? So
if it's related to the cold, it could be anything really. If it's related to the cold, it might just be an allergic thing. But you should err on the side of caution. If you have any sort of chest pain, it's better to assume it's from the vital organs in the body and go and get it checked out. Any sort of chest pain. So is it from the lungs? A lot of people who get clots in the lungs have chest pain. Is it a heart attack? A lot of people who have a heart attack have chest pain. Then there's this thing that usually happens where a blood vessel tears because of high blood pressure. Is it that? So the advice I have to give to her, is that she needs to go and get examined by the doctor, so that these risks are excluded.
Okay. Then you have somebody asking, hello doctor, thank you for your insight. I was anxious about this program. About 4 weeks ago, I went to a clinic and my blood pressure was high. I did a lipid profile and RFT tests, and my lipid came up with the cholesterol slightly high. I was put on amiodarone and losartan H, but the weeks that followed, my pressure started measuring normal and sometimes even low. So I stopped for a few days and I was okay. Does this mean I could get off medication?
Can you answer that question, Sophie? Because it's what we've been teaching, right?
No, you should not get off medication.
Okay. First of all, the first question, was he actually hypertensive or not? Because he went to the clinic and one blood pressure reading was taken. So maybe he was never hypertensive. Because we said hypertension means a sustained rise in blood pressure. Okay? So if he came to the clinic, he should have gone home and measured his blood pressure, monitor it for a few days and see what happens to that. It still could have been high blood pressure, and then the doses of the drugs are really high for him, and then all they need to do is to go and reduce the blood pressure, or even just to monitor. I would vouch for monitoring the blood pressure of medicines. So, like now he's off medication, she or he's off medication. Let her or him measure the blood pressures over the next month at home, morning and evening, and if they are normal, then there's no reason why he should have started medicine in the first place. He was never hypertensive in the first place.
Okay. I am Derek from Chegegwa. Thanks for the program. Is it recommended for patients to take these measurements every early morning without eating something or after eating something?
It doesn't matter.
Okay. You can do the readings you can do the measurements at any time. Good morning, madam. I am Martha and I have high blood pressure since 2019. And at first it's high blood pressure and no problem with the medicine. With time, I started feeling very bad whenever I take medicine. And when I tried to stop it, I couldn't sleep. Breathing became a problem at night, and I went for a checkup. I was told that I have pressure of lungs. I'm really confused about my health because when I take medicines, I feel very bad.
So I think hers is a little complicated. It's not something that, you know, it's not a problem that you can solve in this setting. So pressure in the lungs is a different disease altogether. And I think at some point, you know, one of our colleagues is going to be speaking about that. Usually it comes in because of a complication of clot in the lungs. And then the pressure in the lungs goes. A whole different kind of animal from, you know, high blood pressure. Although some of the medications that we use for high blood pressure can actually be used for the same. So I don't know exactly what we're talking about here, but I empathize with her condition, and I think that she can come to the Heart Institute at some point. We could solve those issues for her.
Okay. Then hello UBC, doctor. Can reducing oil intake through food help? For example, taking unfried foods. This is Martin from Gulu.
Yeah, Martin, it does help. There is such a diet, as we call dietary habits to stop hypertension. Dietary habits to stop, we call it a DASH diet. And that diet emphasizes, you know, fruits, vegetables, and nuts, and less frying, and less animal, you know, products in the diet. And it's been shown to reduce blood pressure by about 5 to 10 millimeters of mercury without actually being on medication. So that's why I said we first emphasize diet, exercises, and we see what that does, because we recognize that improving our diets actually controls blood pressure.
Okay. Doctor, I can see we still have so many people still dying to have their questions addressed to, but unfortunately, we're going to have to cut the conversation short. Doctor, what's your take-home message for a person watching you?
Yeah, I think the most important thing is to be able to know our numbers, and not just for high blood pressure, but all other diseases, lifestyle diseases. So you want to know your cholesterol numbers, you want to know your sugar numbers, you want to know your blood pressure numbers, because you don't want to be a victim of a complication when you've never measured your blood pressure. And then if you know your numbers and your numbers are high, then you work with your healthcare professional, your doctor, to have those numbers reduced, because if they are high in a sustained manner, then they're going to cause problems. And then the other important aspect is that your health lies in your hands. And don't forget the needs, because those needs, nutrition, exercise, educating yourself about these conditions, your drugs, and self-monitoring are important aspects of you know, empowering ourselves to take care of our health. And that's what's needed to control high blood pressure, but also for most other chronic diseases.
Okay. Just like doctor has wrapped it up and said it all, high blood pressure is called the silent killer, and that's a fact. I'll urge you to check and know your numbers. What he has said, he said it, and it is very true, because your health is your say. At this particular time, I'd like us to hand over to the Committee of Parliament that is coming your way just right now. Enjoy the rest of our programming.
A small committee in the judiciary to study this issue of bail. Court has come up several times. We must get medicine for it. We must get medicine for it on how to correct it, how to pay it, and the amount.